Radhe Radhe to all, and I hope everybody is doing perfectly fine. So today we are going to discuss HbA1c in very short. So what type of test it is, why it is done, and how it should be done. So basically, you will hear HbA1c from every other individual. They know about this test basically. Like if patient is diabetic, so they will be aware of this test, HbA1c test. So what it holds importance. So it is also known as your A1C test. It is a glycated test. And what it does, blood with the normal fasting and postprandial, the fasting and PP sample, as you say. So what we know about, so we can say कि हाँ कंट्रोल में चल रहा है नहीं शुगर इसकी मॉर्निंग का लेवल क्या है फास्टिंग लेवल क्या है पोस्ट प्रैंडल खाने के बाद का लेवल क्या है but what HbA1c does it will tell you in last how your blood sugar has been over the past 2 to 3 months. So it basically it gives you a 3 months check. कि 3 महीने में कभी ऐसा हो सकता है if I'm doing my fasting today it is normal, but if I'm doing my fasting tomorrow it comes to be elevated. So that does not signify. So that will not. It will not signify. It tell us what was the control over 3 months of period. So basically it is used to diagnose also the patient who are under the pre-diabetic range. तो उनका डायग्नोसिस वो HbA1c randomly कराते हैं कभी तो they will come to know that they are in the pre-diabetic range. Then similarly, it helps in monitoring the diabetic. Once a diabetic, so they go for this screening. Every 3 months, they will go for a check whether last 3 months में मेरा sugar level सही है या नहीं. So why it is important? So this also helps in determining how well the blood sugar levels are being controlled. So this is just a value. So normal value होती है when you get your, this is a numeric percentage में आता है. There's no unit in it. It's percentage. So if your HbA1c report comes at less than 5.7, it is normal. If it is between 5.7 percentage to 6.4%, it is you are in diabetic range. You should be like it's an alarming sign. You should modify your lifestyle and your diet. That if it is more than 6.5, it is higher. You are in a diabetic range. So why it is high levels क्यों important हो जाते हैं कि 3 महीने में अगर चलो आज मैं कह रही हूँ मेरा controlled है sugar, fasting PP is normal. So why I need to get this HbA1c done? Because HbA1c ने बताया कि 3 महीने last 3 महीने में आपका sugar control नहीं रहा है. So what happens? You are prone to get serious complications like nerve damage, kidney problems, heart disease. So even a small reduction in HbA1c, if you are able to reduce it, it will lower the risk of these morbid conditions significantly. So patient should be advised for regular screening for the last 3 months check if the patient is diabetic also because जो chronic complications होते हैं diabetes के वो अंदर होते रहेंगे if एक uniform control नहीं रहता है patient. So HbA1c if a diabetic patient एक diabetic का patient है जो insulin ले रहा है medicines ले रहा है उसकी अगर HbA1c 5.5 आ रहा है it means he has controlled his diabetes over the last 3 months with his diet and proper medication. So this will help you diagnose diabetes or pre-diabetic condition. This test, it will monitor the diabetic patients, and it will also assess the risk. अगर uncontrolled है तो these all complications can be there in the patient. So you need to adjust your plan and then guide treatment adjustment also. Suppose if HbA1c is not controlled in diabetic patients, so maybe that patient require insulin now or some other medications has to be shifted or changed. Then that is why it is not just a diagnostic tool. HbA1c is not just a diagnostic tool. Don't consider it as a screening tool. It is basically a way to stay proactive, alarming condition, and you have to take steps for your healthy lifestyle, about your health. Be vigilant about your health. Go for HbA1c screening if you are diabetic or you think you have diabetes. There are family conditions, family history here. So basically it will give you a check and you can modify your lifestyle, you can go for exercise, workouts, proper diet management, and that will lead you can lead a happy lifestyle. Thank you so much for your patient hearing. Kindly like, subscribe, and share my YouTube channel Paco with MK. Thank you.